you are over 60 and have sciatic leg pain, and you've been doing exercises to try to get relief, I need you to stop and watch this video right now, because there are 5 exercises being recommended everywhere, online, in gyms, and by well-meaning people that are not helping you. They're making your sciatic pain worse. And the reason they're making it worse comes down to what's actually happening inside of your spine at your age. In this video, you're going to find out the 5 exercises that are completely wrong for sciatica after 60 and exactly why they're hurting you instead of helping. Keep watching. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. To understand why these exercises are wrong, you first need to understand what is most likely causing your sciatic leg pain after the age of 60. Let me explain. There are 2 main causes of sciatica. The first is a disc herniation, where the disc bulges outward and presses on a nerve root. The second is lumbar spinal stenosis, where the canal inside the spine has become narrowed over time and is compressing the nerve roots that travel down into your legs, causing pain, numbness, or weakness from the lower back all the way down to the foot. After the age of 60, the most common cause of sciatica is lumbar stenosis. And here's the thing to be aware of. The majority of exercises recommended online or for sciatica were designed for disc herniations, not stenosis. These are 2 completely different conditions with 2 completely different movement needs. Doing the wrong exercises for the wrong condition will aggravate your symptoms every single time. In your lumbar spine, there's a central canal where nerve roots exit on each side. When stenosis has narrowed that canal, any movement that compresses the posterior elements of the spine increases pressure on those nerves. That's exactly what these 5 exercises do. Starting with the first and one of the worst exercises you can do over the age of 60, especially if lumbar stenosis is causing your sciatica. Trunk rotations and twists. It feels like it should help. You sit in a chair and rotate side to side. Maybe do a gentle spinal twist on the floor, and it feels like you're loosening your back. But if you're over 60 and dealing with sciatica from stenosis, this is one of the worst movements you can do. Here's why. Tell me if this relates to how you've been feeling. You twist, and maybe at first it feels like a stretch, but later leg pain flares up, or the numbness travels further down the leg. In lumbar stenosis, the space available for the nerve roots is already reduced. The L4, 5, and S1 nerves exit from the lower lumbar spine. These are the nerves that eventually join the sacral nerves to form the sciatic nerve, which passes through the buttock and down the leg. When those nerve roots are irritated or compressed at the spine, the pain you feel travels along that entire pathway. Now, think about what trunk rotations actually do to the area. When you rotate your spine, you create a combination of compression and narrowing at the back of the spine, especially at the facet joints and the intervertebral foramen where those nerve roots exit. When you rotate on one side, that space becomes even smaller. At the same time, after the age of 60, those facet joints are often arthritic. The cartilage is thinner, the joint spaces are inflamed, and there's less tolerance for shear force. Rotation adds a grinding type of stress across those joints, which increases inflammation and further irritates the nearby nerves. So now you have 2 problems. The space for the nerve root is being mechanically narrowed, and the surrounding joints are becoming inflamed. That combination increases sensitivity of the nerves, which then sends more pain down the sciatic nerve. This is why twisting can feel harmless in the moment, but later lead to increased sciatic pain. The movement is not decompressing anything. It's doing the opposite. It's increasing pressure exactly where you already have the least amount of space. And this is where most people get misled. These exercises are often recommended for general back stiffness or even for disc-related issues in younger individuals. But spinal stenosis is a different condition with a different mechanical problem. It requires completely different movement strategy. That brings us to another exercise that seems helpful on the surface, but under the same conditions creates a significant amount of stress on the lumbar spine. Exercise number 2, crunches and sit-ups. You've been told to strengthen your core, but crunches and sit-ups are one of the worst exercises you can do if you're over 60 and have spinal stenosis. Now this is where it gets confusing. Bending forward is often the direction that gives relief with spinal stenosis because it opens up the spinal canal and reduces pressure on the nerves. So it makes sense to think that this is the type of exercise that would help. But there's a difference between gentle, controlled flexion and compressive, repetitive flexion. Crunches and sit-ups are not just bending. They're repeated, loaded movements that create compressive force throughout the lumbar spine. Each rep adds pressure, especially to the lower lumbar spine, where stenosis is most common. So even though the position is technically correct, the way it's performed turns into a problem. This repeated compressive nature of the movement irritates discs and joints instead of relieving pressure. This is why you might feel okay during the exercise, but your sciatica increases afterwards. The direction is right, but the load is wrong. So if flexion under load is a problem, the natural reaction is to go in the other direction, and that's where bigger issues start. Exercise number 3, Supermans. This one is often recommended to strengthen the lower back. It looks simple. You lay face down and lift your arms and legs, trying to build support for the spine. But if you're over 60, this movement creates the exact problem you're trying to avoid. The issue is the position your spine is being pushed into. This exercise forces your lower back into extension. That means arching backwards. In lumbar stenosis, extension reduces the available space inside the canal. The structures at the back of the spine compress together, the canal narrows, the pressure on the nerve root increases. So while it feels like you're strengthening your back, you're repeatedly closing down that space the nerves need. This is why people often notice their leg pain, numbness, or heaviness increase afterwards doing this exercise. It's not building tolerance, it's compression. Trying to strengthen your back is not the problem. Putting your spine into a position that increases nerve pressure is. Now, the next exercise is frequently prescribed for sciatica and spinal stenosis, but one part of the movement is exactly what you want to avoid. Exercise 4, Anterior pelvic tilt. Pelvic tilts are commonly given to people with sciatica and stenosis, but one direction of this movement is where the problem starts. Pelvic control is important. Being able to move between posterior and anterior pelvic tilt helps you stay mobile and reduces stress. A posterior tilt, where the pelvis rotates backwards and the lower back gently flexes, is often helpful for lumbar stenosis. It can reduce pressure on the nerves. The issue begins when the movement shifts into an anterior tilt. This is where the pelvis rotates forward and the lower back arches. That motion forces the lumbar spine into extension. In lumbar stenosis, extension closes the central canal and increases pressure on the nerve roots. If you're already dealing with sciatica, repeatedly moving into this position can make your symptoms worse. So while part of the pelvic tilt movement can be beneficial, the anterior tilt reinforces the exact position that aggravates the condition. The goal is controlled movement without pushing into excessive extension. This is where most people go wrong. Now, the next movement seems unrelated to the spine, but the way it's performed brings the same problem back. Exercise number 5, standing hip extensions. This one is often given to strengthen the glutes and support the lower back. It seems harmless. You hold onto a surface and kick one leg straight back. It feels like you're working the hip, not the spine. But patients with stenosis, the way this is done creates a problem. The issue is not the leg moving back. It's what your lower back does during that movement. Most people don't keep the motion isolated to the hip. As the leg moves back, the lower back arches. That puts the lumbar spine back into extension. And as you already saw, that reduces pressure in the spinal canal and increases pressure on nerves. So even though you feel the glute working, you're also compressing the lower lumbar segments at the same time. And because this is done one side at a time, that pressure is often more focused on the side of the moving leg, which can directly aggravate the sciatic leg pain. This is why it can feel like a good muscle exercise, but still make your symptoms worse. The goal is to strengthen the hips without forcing the spine into extension. Most people are not doing that with this exercise. You now know which exercise makes sciatica from spinal stenosis worse after the age of 60. These are common movements, often recommended with good intention, but they're not matched to what is actually happening in your spine. Now keep watching, because in a moment I'm going to show you what to do instead and refer you to some of the best exercises for relieving leg pain from spinal stenosis. If you found value in this video, take a second to like it and share it with someone else dealing with the same issue. Most people are still being told to do the wrong exercises, and this information can make a real difference. I also want to hear from you. What have you been told to do for sciatica? What makes your leg pain better? What makes it worse? Drop a comment and let me know. Here is the key part to remember. With lumbar stenosis, especially after the age of 60, you want to avoid movements that push your spine into extension and close down the spinal canal. These movements increase pressure on the nerve roots and make leg pain worse. Instead, focus on movements that gently favor flexion. These positions open the spinal canal and reduce pressure on the nerves and are more likely to relieve your sciatic leg pain. The next video you should watch are the 5 best exercises you can start doing right now for lumbar spinal stenosis. Go watch this video next.